Suicide Awareness and Prevention, Child and Adolescents, ages 12 through 17. As defined by the CDC, suicide is death caused by injuring oneself with the intent to die. Symptoms of suicide ideation may include, but is not limited to, depression, anxiety, and mood swings. Signs of suicide ideation may include, but is not limited to, giving away possessions, risk-taking behavior, hopelessness, and isolation. In 2017, Black youths have seen an increase in suicide deaths from 2.6 per 100,000 population to 4.8 per 100,000 population in 2018. Whereas from 2018 to 2020, the rates of suicide death decreased 10% overall for youths ages 12 through 17, from 7.0 per 100,000 population to 6.3 per 100,000 population. From 2018 to 2020, we have seen an increase in suicide deaths in the ethnic youth adolescent ages 12 through 17. The rate of suicide death among this adolescent group increased 2% for Hispanic adolescents from 4.9 per 100 population to 5.0 per 100,000 population, whereas non-Hispanic white adolescents saw a decrease of 13% from 8.5 per 100,000 population to 7.4 per 100,000 population. Treatment to increase prevention of suicide may include emergency services, hospitalizations of inpatient care, and/or partial hospitalization care. These services aim to reduce the risk factors by treating symptoms through therapeutic services that focus on reducing anxiety and improving depression. This is achieved by engaging the patient in behavior activation and pleasant event scheduling, which may include art therapy, journaling, vision board activities, and music group sessions with a clinical focus on addressing the patient's current symptoms. The services may also assist with risky behaviors such as cutting, overdosing on pills, and suicidal thoughts with an active plan by safety planning to reduce access to lethal means while improving resilience through family support, community support, and therapy and psychiatric care, including medication management. As an aspiring social worker focusing on policymaking for children and adolescents, my goal is to increase the availability of mental health services in our communities. I see my role evolving into that of a social work administrator, concentrating on developing clear and effective policies and procedures to assist clinicians in providing mental health services to families and communities. My continued interest in mental health administration stems from my passion for helping my community and families. Over the past 15 years, I have focused on mental health policies and procedures, working with clinicians to ensure that resources and services are available to those in need to improve their mental health.
Hi, I'm Annie Bradencourt. I'm a social worker at Johns Hopkins. I'm part of the LGBTQ identity community, and words that I would give to a youth who is potentially going to try and commit suicide would be that it gets better, and that being an LGBTQ child is often much harder than being an LGBTQ adult, because when you're an adult, you can pick your community and your resources. And in terms of a resource that I would provide that's outside of general talk therapy, I think that community is really important for people who identify as part of the LGBTQ identity, and I would say to find a support group of other teens, honestly, to do social events with. So to socialize with, not necessarily art or music or anything specific related, not even therapy related, but finding a community that you can be a part of virtually or in person.
Hi, my name is Shakia. I am a psychiatric nurse here at Johns Hopkins Hospital, and I work with the pediatric population. So one word or phrase that I would give to encourage a youth that is experiencing a mental health crisis or considering suicide is weather the storm because the sun awaits. And meaning that there are going to be tough moments that we have to get through, but there is sunshine and there is light at the end of the tunnel. One resource or way to cope through those moments that I can personally identify with is through dance. And I find that being able to ground yourself through movement, being able to incorporate the use of music is very refreshing and also very enlightening, and you're able to sometimes communicate your distress or your feelings in movement and not using words, because sometimes our feelings are that intense that they can't be expressed through words.
My name is Renee Williams. I am a master's level social work student at Morgan State University.